We begin with Ebola spreading for the first time on American soil. The CDC is blaming what it calls a, quote, breach in protocol. A healthcare worker who treated an Ebola patient at a Texas hospital contracted the disease herself. It is the first transmission in the United States.
That woman is one of many on the team who cared for Thomas Eric Duncan. The CDC isn't ruling out the possibility that others could be infected too. Manuel Bojorquez is at the hospital in Dallas where the new victim is stable. Manuel, good morning.
Good morning. The nurse is being treated in an isolation unit here at Texas Health Presbyterian Hospital after developing a fever over the weekend and testing positive for Ebola. It's a development made more troubling by the fact that she was equipped with gear that was supposed to prevent transmission of the virus. A hazmat team spent hours decontaminating areas around the nurse's Dallas apartment on Sunday. She was part of the medical team that treated Thomas Eric Duncan at Texas Health Presbyterian. Hospital officials said she had extensive contact with Duncan on multiple occasions.
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield.
But 2 days after Duncan died, she developed a fever and later tested positive for Ebola. The CDC said it was prepared for the possibility of a healthcare worker becoming infected in the U.S., but officials said the new case has them deeply concerned.
At some point, there was a breach in protocol, and that breach in protocol resulted in this infection.
Protocol for removing the protective gear is critical because the process can expose health workers to the virus. Officials said the nurse had yet to pinpoint when a lapse may have occurred. The CDC said it will now reevaluate protocols for using protective gear and limit the number of healthcare workers who have contact with Ebola patients. It is also working to determine how many other people will need to be monitored 21 days for possible exposure. In the nurse's neighborhood, volunteers handed out flyers about Ebola, and those within a 4-block radius received a reverse 911 call.
Please be advised that a healthcare worker who lives in your area has tested positive for the Ebola virus. Precautions are already in place to clean all known potential areas of contact to ensure public health.
The call was meant to reassure neighbors they are not believed to be at risk. But the sight of yet another Dallas apartment being decontaminated was unsettling.
It's scary, it's creepy that it's just a few houses down.